Hey guys, it's Dr. Mercy with Agility Physical Therapy and Sports Medicine and 5280 Restorative Medicine. And I want to talk to you for just a couple of minutes about insurance and what it costs, what they value, and what they truly see in terms of how we should be treated as Americans in our healthcare system. Last week I was kind of annoyed because this email came out from the American Physical Therapy Association, of which I am a member. There were actually two emails. I'm going to tell you about the first one related to insurance. And I actually was so frustrated by this that somebody else had taken a piece of the email, the photo piece of that email, and reposted it on their Facebook page. And I actually put this really snarky comment. And then afterwards that, maybe that wasn't the best thing, but it's truly how I feel. So, one particular insurance company contacted the American Physical Therapy Association because 11.3 million people that they insure had back pain in the year prior. So in 2018, 11.3 million people had back pain. Only 2.3% of that 11.2 million people saw a physical therapist. And they said that they're doing a joint venture with the American Physical Therapy Association in 2019 and 2020 to improve the rate of access to physical therapy because of that. Because all of the research shows that physical therapy is better for back pain and neck pain than drugs, surgery. Imaging doesn't really change the way we treat. It's better than injections, and it's better than doing nothing. So when we're looking at what the insurance companies truly value, one of the things I don't think most people understand is that same insurance company started using a third-party administrator. That third-party administrator actually takes part of the money that should go to the physical therapist. And that third-party administrator also put in place some extra steps, hoops that the physical therapists have to jump through in order to get pre-authorization. I live in Colorado, and Colorado's a direct access state. So what that means is that you should, if you have back pain, be able to call me on the phone and say, hey, I've had back pain for the last 3 days. I just want to come in and get it checked out and see what we can do about it. And you should be able to walk into my office and use your healthcare insurance, no problem. But this third-party administrator actually requires a referral on file, which goes against what direct access stands for. And they require us to fill out this paperwork that's additional to normal intake paperwork, and you have to fill out a section of it. Then we have to upload it to a separate third-party website, and then we have to wait 48 hours to see if we can actually see you again. How is that going to increase the number of people who actually access physical therapy for back pain? That third-party administrator is making us jump through hoops that shouldn't be there, especially when we know that we're the most cost-effective option. That same insurance company this year denied an appeal because they said I wasn't using the best evidence medicine when the research that I pulled was from 2015 and 2017, and the research they were quoting was from 2001. Who's not using the best evidence-based medicine? It's certainly not me. And when you look at what they allow and what they don't allow, most insurance companies allow about 20 visits per calendar year. That's pretty standard. However, I have a guy right now going through a hip protocol that's 6 months long. And yes, we're in week 14, week 13, and he does drop down to once a week from here, but it's still a 6-month protocol. We've already surpassed the number of visits allowed in his insurance plan because we're at week 13. He'll be seen twice this week. That's 26 visits. He's already paid for 6 visits out of his own pocket because his insurance company wouldn't have covered them. only he had this surgery that they were willing to pay for without him doing physical therapy for the hip first. But that's the protocol. An ACL protocol is usually about 12 weeks worth of physical therapy if you truly want to get back to sport. And it's usually 2 to 3 times a week for 12 weeks. Those are the protocols. And again, that's 24 to 36 visits. And then once a week to once every 2 weeks for up to 6 months as we return you to sport to make sure that nothing happens so that your knee doesn't become unstable again, or that you don't injure another muscle or your back or your hip because you're compensating. Most of the rotator cuff protocols are 2 to 3 times a week for 6 months. I don't know about you, but 20 visits per calendar year doesn't exactly cover 6 months worth of physical therapy. I'm concerned that these health insurance companies put all these stipulations in place because they don't want you to use your benefits. My goal as a physical therapist is get you back to where you want to be and where you need to be able to function the way that you want to. I don't want to have to fight with your insurance company because they don't believe that what physical therapists do has value, even though the research shows that for back pain, neck pain, knee pain, hip pain, shoulder pain, the most cost-effective option is me, or people like me. If you agree that physical therapy should be the number one choice for every ache and pain that you have in your body that starts from a movement, please like and share this video and give some comments below so that we can know what your thoughts are. Thanks and have a great day.